somebody just stops responding to the treatment. Either you don't respond to the treatment or you get better and you go back home, right?
Hello and welcome to Blether with Barberra, and today my special guest is Dr Nikhit Anilbhai. He is a entrepreneur and founder of YourQ, and he's here to talk about the new narrative he's introducing into healthcare and on a nanotechnology level as well. This is some interesting stuff that he's going to talk about today, and we're going to ask him some questions as I normally do, and we're going to have a blether. So, Doctor, if you just want to introduce yourself to my audience and who you are, what you're about, and why you are where you are at the moment.
Okay. Hi, everyone, and thanks, Brian, for having me. My name is Dr. Nikhit. I'm a medical doctor by background. Did medicine from India in 2019 and straight away came to the United Kingdom for a master's in nanotechnology and regenerative medicine at University College London. The master's was an entry route into research to enhance regenerative medicine, and I felt like I was going to transition from being a practicing doctor to go behind the scenes and work with drugs and work with nanoparticles and see if we could, find a way to build some sort of nanomedicine for humans. Unfortunately, the way my career has panned out got super impacted by the pandemic in 2020. So had to leave my course, pause it, go back to India for about 6 to 8 months, and naturally went back into practicing medicine full time. And there was actually a period of time where I was working 24 hours a day, 5 days a week. I in between two hospitals, literally living out of my car. Did that for about, I think, 3 months until I met with a car crash, and then I was in bed for quite a bit. Eventually came back to the UK in February 2021 and decided to finish my masters and see how it goes. But life had different plans. Once I came back, I lost my dad in 2 months. Right after that, he got COVID, and then I couldn't go back because of all the restrictions. And I really felt that there has to be something that I could have done, or to improve the way he was looked after in one of the hospitals. So I had an idea earlier when I was practicing in India in 2020, which I tried to build something out of, but then due to the car crash or due to whatever circumstances, I thought, I'll let it go and go finish my masters. But then once I lost my dad, I think that was the final nail in the coffin, right? I felt like I should have built that idea. I was already trying to build an app for monitoring vital signs for patients who are in hospitals, so that when the consultants are not around, they don't get regular updates. They have to depend on the staff to be vigilant and to find out whenever something goes wrong and inform them. So I was trying to build some sort of software for that, but then eventually by the end of 2021, I realized it has to be a hardware device that we could put on every single patient, so that it would not be dependent on any nurse having to be around to check the vital signs and then upload it on the app. And that's probably how YourQ was born. I've been doing this for the last 4 years and something. So we've been building small wireless devices aimed at different populations. So one of the ones that is probably going to go out this year is for newborn babies in intensive care units. It's a wireless device that sits on the sole of their foot, opening doors for those babies to not be tied down to that bed. They could receive kangaroo mother care even though they are in ICUs. But at the same time, all that data that would be collected would go onto a cloud platform, would enable remote alerts, allowing clinicians to constantly have an eye on their patients when they're not around. Another version is a slightly futuristic device that we've been working through Innovate UK over here in the UK to develop. It's a small wireless device that fits on your finger, so it's aimed at people who live alone. So in the event that they were to suffer a cardiac event whilst they were alone, this device would be able to detect that event and be able to call emergency services by itself. It's still in heavy R&D. We've done some work and we are continuously pushing boundaries over there as well. But yeah, thanks for having me, Brian.
No, that's so interesting. Just as we discussed prior, and we know because of following each other, I've got that background in medical law, medical legal. So no, not a clinician by any means, but obviously the legal side. And knowing neonates is where you're talking about with the children. Is it's from what I can gather from your bio is such a high risk area of medicine because these children are very under 28 days old, and very vulnerable, and particularly if they're premature as well. And that's a big thing at the moment as well. I noticed within the NHS, they do have midwifery issues. So that would be a fantastic piece of technology to help out in that area of medicine. What I'm really keen and interested in myself, just a lot of my followers will be aware of dealing with a person that lives on their own. I am actually also a part-time personal assistant / carer. So I help vulnerable people in their own homes, stay in their own homes before they go into care. So we do have a lot of people, and we do have a thing called Care Call, but it is just a button that you press to go ring a service that rings you back and says, "Are you all right, Mr. Jones?" or whatever. And have systems for people who we know have got comorbidities like heart disease, etc. Then that, especially people who are susceptible to TIAs, because we have a lot of people, especially when they get to a certain age, they do get a lot of TIAs, so mini strokes for people that are not in medicine. To pick things up like that, and if that was to link into the care call system, so this is the emergency system, goes straight through to an emergency, that is so much better, because I can explain to you, and this might be helpful for you in your research as a person that cares for people. They do not like to press the button when they have an incident. So they do not ring it. And we do find a lot of people on the floor for 6 hours in the morning because they just don't want to bother anybody. And when they're ill, they don't bother people, and we go and find them and they've just had a heart attack, or they're on the floor because they've just had a stroke. And they just don't ring anybody. They don't press the button even though it's on the neck or on the wrist. So to have something would be so helpful for a lot of people that we look after, and not just in Scotland, in my area, but across, obviously, the UK and the world, because elderly people are very stoic and very independent, and they don't want to bother anybody. So that's just fabulous. I want to probe a little bit deeper, Doctor, if you don't mind. So I'm going to ask you a series of questions, and obviously these are all around your technology, your startup, and obviously linked to healthcare and medicine, and that's great for our audience. We do like to have a natter about healthcare rather than ignoring it, because we don't like to ignore. So you started out as a medical doctor before co-founding, obviously, YorkU. After working on the front line during the pandemic, what was the moment you realised the healthcare system needed systemic change and not just individual effort?
There were many flags, I would say. It's not just from the year that I practiced during the pandemic, right? The entire shift in myself, I would say, was started during my year of internship, or as it's known as rotating housemanship here in the UK, where I was practicing in different departments, and I just couldn't find myself the satisfaction of doing something on the front line or on the ground, right? And the more I kept on practicing, I started to realize that yes, allopathic medicine is definitely one of the greatest inventions of the last century, right? But is it being used in the right direction, or is it being used for the right purposes at all the times is a questionable. It's a question, right? Because I've seen my mother suffer from diabetes for the last 25 years. And looking at the number of tablets that she has to take on a regular basis, insulin, but none of it is curative. It's just helping her manage her symptoms. And somehow I cannot make my peace with that. So, my entire reason for shifting from medicine itself to transition into some sort of research was I felt it within me that maybe things could be better. And one of the reasons I chose this course at UCL at that point of time was also because there was a lot of shift towards nanomedicine and tissue engineering. So essentially, trying to program your own body to repair itself rather than keep giving it some sort of supplements or some sort of medicines from the outside, hoping that it'll keep curbing the problem until something else shoots up, right? And I've seen this a lot in all of my patients in the very few years I've practiced, but I've seen that, once you give somebody something, for example, for diabetes or for blood pressure, you keep giving them a drug. Maybe that drug lasts them for 5 years, 10 years, 15 years, but then the body finds a way to bypass that as well, and then you've got to change the drug and then target the same thing from another angle, and then you keep doing that again and again, and it's not a cure. And I on a personal level, I find it really hard to agree with that and keep practicing, right? And one of the real things that I couldn't digest during the pandemic was, when you get a fever. Just look at 100 years ago. What people do when they had a fever? We didn't have paracetamol then. So people would drink fluids, they would hydrate, they would probably keep a cold cloth on their head, and they would, stick it out. They would wait it out, the fever would break, and they would come back. Now, as a medical doctor, we were taught that the body creating a fever is literally one of the defense mechanisms, right? You have multiple layers of defense. Once everything is breached and an organism, a microorganism enters your bloodstream, the only thing left for your body is to try and kill it by raising the body temperature, because all these organisms, they will only attack you if they can survive within your body at that temperature, right? That's why you're a favorable host for it. So one of the easiest things to do when something like that happens is to literally let the fever run its course. Should you just let your body increase its body temperature from its optimum temperature to an uncomfortable temperature? Of course, you're going to suffer as well, right? On a whole systemic level, your body is not going to be able to perform at 100%, because now your own body temperature is not favorable to your body cells as well. But any human being is trillions and trillions of cells. But at the same time, any microorganism that has probably entered you is going to be in the thousands, if not maybe hundreds of thousands of cells, and they replicate within an hour. A bacteria can go from 1 to 2. Your human cells probably take 24 hours to replicate, right? So if you give them that window period by reducing your body's temperature for, let's say, 6 hours, 8 hours, you've actually given them ammunition, because now in those 8 hours they are multiplied 2 raised to 8, and now your body actually does not have enough time to build resources to actually defend against those like organisms, because they are
Yeah.
growing much quicker than your body can respond. So the fever is literally a way of your body to put a brake on whatever's gotten, not allow them to replicate, while at the same time your body tries to find a way to beat that. But I remember during my days in the pandemic, when I was trying to convince my patients to not take paracetamol, they started thinking this is a doctor who doesn't know medicine, and I faced quite a lot of backlash during those days, and it made me quite uncomfortable. But I was very firm in my beliefs. So whenever my family members got COVID, I would make sure that they would not take paracetamol. They would let the fever run its course, just manage it to make sure that they don't go through side effects of it. But yeah, those are my beliefs.
No, and you are in good company in relation to your beliefs, because as I mentioned previously, outside of here, and people know I've worked in medicine, medical law, so I worked through the pandemic and saw what most people don't see, and with my own cancer struggles and health, I'm very agreeant with you that there is alternatives just to going to the chemist and saying, I was a great believer in going to the chemist years and years ago when I had a cough and getting a balsam or some form of medicine. I need something to get rid of the cold, etc. And now I realise, absolutely, when you do the research and you look into how the body works properly, it's much better to let it run its course. In those situations, we're not talking condoning or in some sort of sepsis going on, but when it's just a sore throat from just you've caught a cold from your friend who you know's got a cold, when you go to the doctor, the pharmacist, and you say, give me that balsam, that medicine, it just prolongs the condition and it just leads it to stretch longer and longer. And I didn't realise that, and then the penny dropped, and then it's also pennies all drop, and I'm not against the treatment. As you mentioned there, the modern medicine is a wonderful thing, and it's helped a lot of people, and it saved my life 10 years ago. But we don't need to go and get a paracetamol every time we get a sniffle, and we don't need to go get medicines, we can fix things. And as a person that's also not just a podcast host, I'm also the founder of Barberra's Botanicals, which is more of preventative. I'm very much a believer that preventative is better than curative. If we can manage it, because, being a person that's got prostate cancer, if we could have prevented my prostate cancer, it'd have been a lot more easier than me having to deal with the curative side of it. Absolutely. And losing bodily functions and things like that. So I'm totally with you. I think the pandemic has caused an almighty health anxiety epidemic, and I have got that agreement from a lot of doctor friends that I have from my old role, and worryingly so. But it's also created a discussion that's much needed around healthcare, and it has created a sort of trend in supplements, and I get that. People look at me as a business and will say, oh, you're just a witch doctor, or, oh, you don't know what you're talking about. And actually, I don't know, because I'm not a doctor. Medicine is just a matter of thinking, right, we know that this works because of history, but we don't know that that's going to work when we go forward. We just have to test it and see, and it's the same in this. But what we have got is we've got 130,000 years human beings have been on two legs as Homo sapiens, and we didn't get to this point in our living without natural or other alternatives to paracetamol. So I agree with you completely. I mean, fantastic. Thank you. So, Doctor, your company, YorQ, focuses on continuous vital sign monitoring for all patients, not just those in intensive care. What's the biggest misconception about how hospitals currently monitor patients, and why does continuous monitoring matter so much?
Do you wear a smartwatch?
I don't know. I'm not a believer in smartwatches. I've got enough with a smartphone. I don't want to be tracked everywhere else. Thank you very much.
So my example started from a smartwatch because a lot of people own them nowadays, right? And this is how I generally approach this topic. So a smartwatch with any sort of sensor to let's say measure your heart rate or blood oxygen is gonna come off every 5 to 10 minutes. Once every 5 to 10 minutes, it's gonna come on. It's gonna take a reading and it's gonna go off. Which means for any person who is living a regular life, day-to-day healthy life outside of the hospital, their vital signs are going to be monitored. I'm not even going to go into quality of monitoring. I'm just going to say their vital signs are going to be monitored 12 times an hour, maybe more. Let's say 6 times an hour, just for the sake of it, right? And there are 24 hours in a day. So that means more than 100 times any person is going to get their vital signs monitored when they are healthy and outside the hospital. But when you look at the same thing about any patient who gets admitted into a hospital because they're not, as you said earlier, right? A patient goes to a hospital when they're not well enough to treat themselves, when they know this problem they have cannot be solved without the help of a medical personnel. They're going to go to the hospital, they're going to show it to the doctor. Some of those patients are going to be given medicine and sent back home. Some of them who are not well enough to go back home are going to be asked to stay back in the hospital. Now, when this person is in a hospital ward, not in such a bad condition that they need to be in intensive care, but not in such a good condition that they can be sent back home, they are only going to be monitored by the nurses who are on the shift. Now, this nurse is only going to go and check on these patients once every 4 to 6 hours. The nurse will go with a bunch of equipment. They will go to the patient. They will check their heart rate, their blood oxygen, their blood pressure, and they will move on. Which means for any patient inside a hospital who's actually not well, you only have one data point for each vital sign every 4 to 6 hours. Which means for the whole day, they're only going to be monitored a maximum of, let's say, 6 times. So how does that make sense that somebody who is well enough and at home, living a regular life, gets their vital signs monitored 100 times a day, but somebody in a healthcare environment, in a hospital, not well enough to be alone, is only getting monitored once or less than 10 times a day? So this is the argument we started making, and it actually stemmed from my journey of practicing in intensive care during the pandemic. We were losing patients left, right, and center. And of course, people will go and say, oh, India is a very populated country. The number of deaths will obviously more because in proportion of the number of people who are living there, you're going to have more deaths and so on. But that's not the point. The point is when we started losing young patients like myself, I was 24, 25 at that time. And I remember we lost somebody who was, I think, 31 or 32 years old. Now, as a junior doctor practicing a night shift in that hospital where the patients are not even that critical, I used to spend quite a lot of time with my patients. Wherever I could relate to somebody, I'd sit down, I'd have a conversation with them, just to keep keep their spirits high. So I was having very good conversations with this 31, 32-year-old guy. And then one day I come back in the evening from the other hospital, and I'm taking the handover from my colleague, and my colleague says, well, there's a new patient in that bed. And I was like, but this guy he was not that well to go back home. How did you discharge him? And he goes on and he says, we didn't discharge him. He collapsed in the day. And I was like, what do you mean by collapse in the day? And he said, everything was absolutely fine until all of a sudden he started having some sort of convulsions, and then his oxygen dropped, and then we just couldn't revive him. And I was like, how is that possible? That person is like 6 years older to me. He looked perfectly fine. He was not in any sort of other coma. He didn't have, what happened? So when I went back, I started looking at the patient files, and I couldn't find anything. All his vitals and everything was absolutely fine until all of a sudden he died. So that did not sit with me. I do not believe that. See, people have cardiac arrest and people have heart attacks, and those are chance events, right? But for a person like this, suffering a disease, or going through something in a hospital environment, for that sort of a person, you're in a hospital environment because you're expecting someone to look after you. And something like that happening in that sort of a protected environment just did not sit right with me. And this happened multiple times in that stint of 3.5 months when I was working into hospitals. We lost so many patients just like that with no sign of what went wrong. And I really felt that I'm 100% sure there are signs. We just haven't got them because we're not looking at them long enough. And again, with my dad, I felt like that was the same thing that happened. He was in a very good hospital. He was being looked after. But then one day at night, I get a phone call saying we are rushing him to the intensive care. And I was like, but everything that you've said over the last couple of days has been getting better, better, better. Then what happened? And then like he just stopped responding to the treatment. I said, that's impossible. It does not work like that. Nobody just stops responding to the treatment. Either you don't respond to the treatment or you get better and you go back home, right? So yeah, and he didn't survive 24 hours in intensive care because I believe when he reached intensive care, it was already too late.
Yes. It's very much in line with the traditional way of medicine, which is very curative rather than preventative. So very post-mortem, we'll look at the issue post-mortem and
Yeah.
see whether or not we can understand why that person just deceased before us without any, well, there would have been warnings, but if you're not constantly monitoring a person, you're not going to know what the warnings are, because ultimately they may not know the warnings themselves. They'll just think maybe that just the clammy palm or the rush of head, like a thunderclap headache, is something that it just happens to them and won't call out. So I can see that's been so helpful, because I was recently in hospital only 2 months ago, and annoying as it is to be woken every 4 hours in whilst you're trying to sleep, to be taking BP and SATs, etc. It is still only 4 hours, and in 4 hours, I mean, in 4 minutes, a person can die. So 4
Exactly.
hours, and I can see the smartwatch thing where you are constantly monitored and heart rates and you're sleeping and all of those things. So I think that's a good thing that you're doing, and hopefully it can only improve. Well, it'll improve life expectancy of individuals. It also improve quality of life for some individuals. I think, as I would see I'm just going to put my medical legal hat on, doctor, as well, and see that that could reduce litigation against healthcare trusts and unnecessary investigations that can take forever when there's serious events happen. And obviously you'll know the paperwork, and I know the paperwork, and it's lengthy and etc. So it can only be a good thing. So innovation often means pushing against established systems, and we're sort of going along these lines, aren't we, about what we talk about. So what has been the hardest part of moving from clinician to founder and trying to bring a vision like yours into practice?